Hi, my name is Regina Ikong, and I am presenting my proactive health communication campaign. And my issue or topic is fight against depression on women. On this slide, I talk about the overview of the agenda for presentation. The agenda of this campaign is to raise the public awareness about depression, a common but serious mental illness which has a great impact on our community physically, socially, and financially. Raising the awareness for depression can help the public understand the disease, know the symptoms, the treatments, and the need for access to appropriate, timely, and quality care for better care outcome. It is important to look at some statistics on depression and its effect on the population to fully understand why we have to fight this disease and supporting those that are affected, and to increase care access by stamping out stigma. With full understanding through the statistical information, we can better advocate for better health care for the affected. More than 17 million US adults, over 7% of the population, had at least one major depressive episode in the last year, NAMI 2017. More than 300 million people, or more than 4% of the global population, were living with depression, World Health Organization 2017. Suicide is the 10th leading cause of death in the United States, accounting for the death of approximately 43,000 Americans in 2014, Healthy People 2020. Depression is the largest cause of disability worldwide, WHO 2017. Depression is 1.5 times more common among female than male, World Health Organization 2017. And this is why I have decided to fight for the women on their issue of depression. My next slide for discussion is county and subpopulation at risk. The county of my focus is Prince George's County, where I live, and my subpopulation is the women veteran who live in the PG County and receiving mental health treatment at the VA Medical Center, Washington, D.C. Most women veterans live in the rural areas or inner cities where they can afford their living. The health outcome for PG County in Maryland is about average, 11 of 24, county ranking 2019. Premature death is 6,900 compared to 5,400 of the top US performer, county ranking 2019. One issue of concern is the care access. PG County care access indicates 810 patients to one provider compared to 310.1 for the top US provider, and this is on mental health care. These slides continue with subpopulation at risk. The subpopulation, the women veterans living in the PG County, have difficulty accessing mental health care because of the barriers associated with traveling to the city for care. It is important to raise the awareness of women depression and to ensure that they are aware of the different ways that they can fight depression, including receiving care at home through telehealth, via video conferencing and mobile app technologies for self-management of depressive symptoms. The goal of Healthy People 2020 is to improve mental health through prevention and by ensuring access to appropriate quality mental health services. My campaign is in line with this goal. This slide features our women veterans, our heroes. Women veterans have served our country in different capacities, making their families, including mine, and society safe and proud. They deserve the best treatment health care can offer. They deserve societal support and holistic, person-centered, gender-specific mental care that addresses their needs for better care outcome. Next slide features health belief model. And the model I use here is Jane Watson caring theory. The Jane Watson theory offers holistic caring, focusing on the relationships in the caring environment and the interconnectedness between the patient, provider, and the resources in the environment. The patient can attain true healing, helping patient to achieve a higher degree of harmony with mind, body, and soul can only be achieved through transpersonal caring relationships. Continuing with health belief model, telehealth is one vital resource in a technological environment that can be used to meet the unique needs of the women veteran for the treatment of their mental health. Telehealth offers a solution for the complex women care needs. The healthcare needs of women veterans are complex and differ from those of male veterans, biological, gynecological menopause, and different types of military experiences and exposure that affect their behavior and function differently. Brooks et al., 2016. Telehealth helps the women veteran to overcome the many barriers associated with seeking and receiving mental health, which include privacy, cost of transportation, child family care, long waiting time for appointment, and stigmatization. This slide features health promotion campaign itself. The social platform to promote this campaign will include Facebook, Instagram, Pinterest, and maybe holiday like Halloween party with some groups. Dialogue will be encouraged for discussion on the use of telehealth and the advantages that the women can enjoy. There will be a platform for feedback and avenue to voice any concern that women may have and way to get full information and help on depression, telehealth, mobile apps for self-management of symptoms. Telehealth will show us the right care, that women can get the right care at the right time at the right place. It can save travel time and cost for patients, especially in the rural areas. It can improve access to healthcare services and also with other specialists. It can provide quality life-saving routine or preventative health care. It can offer convenient health care on time scheduled. It can help address the shortage of health care providers, including behavioral health. Telehealth can offer alternatives for healthcare in certain medical situations. Overall, telehealth delivers important, sometimes life-saving healthcare services using two-way video, smartphone, and other tools. Telehealth expands your access to high-quality healthcare, saving you time and money. Part of promotion campaign is the self-help options for fighting depression. Um, the women should engage regularly in exercise. There are so many benefits to get from exercising. It will reduce your depressive symptoms. It will increase mood, reduce anxiety. It will increase your self-esteem and well-being. It will reduce your stress level. Getting enough sleep is also very important. Have fun with family and friends. Do not isolate yourself. Try to get support as much as possible. Some support group. Also work with group therapy, it's helpful. Eat well, healthy diet. And when you've done all this and you still feel overwhelmed, make sure you seek help from your professional provider. Seek help if you cannot handle it by yourself. Since this is holiday period, Halloween time, I will host a community party scare away stigma. The biggest hindrance to treatment of depression is stigmatization. Branding people like psycho, wacko, weirdo, crazy, schizo, all these are names that they refer to people that are not looking the same. It is okay not to be okay. Referring to anyone with this branding will hinder them seeking care. It is a negative characterization of one's image and character, and people will try to hide what is happening to them because they don't want to be branded. They don't want to be called names. So for us to break stigma is very important. As a community, let's break this silence and stomp out the stigma. It is okay not to be okay. Mental illness is nothing to be ashamed of, but stigma and bias shame us all. This is a quote from Bill Clinton, and this is very true. Stigmatization will stop people from seeking help in mental health. I have listed all the resources on this slide: National Suicide Hotline, National Suicide Prevention Lifeline, National Institute of Mental Health, Women Veteran Call Center. All the phone numbers are listed, which you can call and get help. And this is my last slide, and it shows the references where I got my information from, and it is listed. And so at this point, I say thank you for listening to my presentation. Thank you very much.